Hello, everybody! Happy National Day!
You can see my effort.
That's what happens when you cannot find your flag.
You just take the tattoo and go, I tried. Effort leh.
Hi, good afternoon, everyone. Welcome to the National Day episode of Life, Love, and Lipidemia. Today, I have a special guest interviewer. She's not Dr. Matthew Lee. This is Jasmine. Hey, Jasmine, welcome. First time we are doing a show together.
Yeah.
As an interviewer, not as an interviewee.
Yeah, I know, right? Then Sean was like, hey, you have to prepare the questions beforehand. I was like, what type of questions?
Hey, but today we're talking about digital health.
Yeah, so like we also have like Dr. Matthew Lee who's with us. And I mean, the thing about digital health is something that's very close to my heart. So when I previously was in MOH, I was looking a lot at digital health and I was working on it with Dr. Matthew Lee. So like he's a very close friend, also my cube mate or my cube neighbor. So he's someone that when we were developing and working on the sandbox, he's someone that we worked together and he provided quite a lot of clinical inputs, which was very, very important to ensure that digital health is provided safely and effectively.
Yeah, and also, I mean, with digital health, it affects all of us, be it you're a consumer or professional, especially for me, even in community, these things start to become a part of reality. So today we're going to talk about digital health, and as always, welcome to the, what episode? 17th episode. 17th episode of Life, Love, and Lipidemia. Hey, hello everyone again. Hey, welcome to the show. If you haven't subscribed, the link is right there. What are you doing? You should have subscribed by now. So many months already. Hey, but welcome to the show. Today we have Jasmine who's going to do the show with me, and of course, together with Dr. Matthew Lee. It's National Day episode. So before we talk about our topic, any fond memories of Singapore, Jasmine?
Fond memories of Singapore. I think, I don't know, maybe because the childhood Singapore was actually quite different. How we used to run to the mama shop and get the 10-cent popsicles, going to the playground when it was sand, not the current one that's like the rubbery thingy. And I don't know, I really loved that. I mean, to me, that was the fondest memory of Singapore because it felt very nostalgic. And now you think about it, it has changed so much, it has evolved so much. And we have also gotten so accustomed to everything that's in place, like the efficiency, the convenience, but you think of the past when, even though there was no convenience and it took a lot of time and the bus had no aircon, it's something really nostalgic about Singapore that you really love and remember.
Hey, Matthew, welcome to the show. Any fondest memory of Singapore?
There are many, of course. Hi, everyone. First of all, thank you for having me, Sean and Jasmine. So, of course, there are many good fond memories. I think one of it is 5 years ago. I think is it the Jubilee celebrations?
50th anniversary,
Yes.
is it?
Correct. So I went to NTP. So I went to the Padang area and I watched the performance. I mean, I watched like the fighter jet, the SIA airplane. All this, very impressive. So yeah, it was very impressive, very memorable experience.
For me, actually, my most memorable experience was not in Singapore. It was actually in Pakistan.
Oh.
So 17 years old, because I captained the national junior team. So we went to Pakistan for the Asian Junior Championship. So one of the proudest moments I had was holding the national, because team captain usually will lead everyone out during the opening ceremony. Yeah, so I was holding the national flag. So that was one of the very proud moments for me. But more interestingly, sometimes we were walking along the streets of Pakistan. Then you have someone to stop you and say, hey, which country are you from? Because our national tracksuit will have the flag, right? Then, say, we're from Singapore. They say, oh, you have a very nice flag. 17 years old. Yeah, one of my fondest memories. Yeah, and then after that we grew up, and yeah, and now we're all in healthcare somehow. Lah.
Yeah.
Yeah, so today we are going to talk about digital health, something that none of us can escape. I think you can say it's the future, but actually the future is kind of been accelerated.
Mm.
And of course, we have Dr. Matthew Lee here, who works at MyDoc as Director of Clinical Ops. So Matthew, why join medicine in the first place?
So that's a good question. Wow, that will brings me back maybe 3 years ago. Okay, yeah. So that brings me back to quite a long time ago. Yeah, it's quite interesting because I like science. Personally, I like science, and at the same time, I also love interacting with people, talking to people. So that kind of stirred my interest in medicine. So when I was in high school, I tried to explore where I want to go in the future. So it has to be a science stream. So there are just that numbers of scientific careers that you can choose from. Professional careers. Especially when you are from a middle class Chinese family, if you don't become lawyer, then you're going to be a doctor or engineer. I mean, luckily for my parents, they're actually quite interested in medicine, right? So partly apart from science and love talking to people, it's also I saw the needs of healthcare in the future. One of it is actually mental health. So I saw back then I read this article from Times Magazine. It actually mentioned that in 2020, mental illness will be the number one conditions in Asia. So there's a real need, and also back then there is people around me also having some form of mental health issue. So that kind of stirred my interest to pursue medicine, and then that's how I ended up doing medicine. Yeah.
So after you practice for a while.
It's kind of funny, right? So because of mental, interest in mental health, so that's got me into medicine. Then I went to medical school, but my interest sort of shifted when I was in medical school. So from mental health to public health. So so after I graduated from a medical school in UK, I practiced in UK for about 2 years before I came to Singapore. Yeah.
And when you came to Singapore, it was sorry. Go ahead, Jasmine.
No, I just wanted to ask, do you see a difference in practicing in the UK and in Singapore?
Of course. Well, I would say, that's the foundation itself, the whole healthcare systems are already very different comparing UK and Singapore. Then again, Singapore healthcare systems is one of a kind, if you compare to any other country. So the fundamental difference between two healthcare systems actually bring out all this a lot of structural differences and also the differences on the ground. When you practice in Singapore, I think the government are quite prudent in terms of spending, and there's always element of self responsibilities, co-payment, all this. There's none of this stuff in UK because everything is paid by the government. So when I was practicing in UK, me and my colleagues, doctors or other healthcare professionals, cost is never at the in the considerations. When we want to do something, we want to prescribe something, just go ahead and do it. It never consider about cost, or whether patient can afford it or not. Yeah.
Like, out of curiosity, do you think because you didn't have to consider cost, it has made clinical practice actually more clinical because you don't have to think about, can the patient afford this, is this treatment too expensive, kind of thing?
In a way, yes, definitely yes, but it goes both ways, right? It can be very good for the patient, but also sometimes you might overprescribe, because you're not thinking so much about the cost considerations, and
That's true.
So then you came to Singapore, and when you came to Singapore, it was straight into into public health?
Correct. So because because of my interest started in medical school, so I tried to tailor my CV back then, my resume all towards the public health specialty. So even when I was practicing in UK, I was working in the public health council, public health institutions in one of the town council, in the city council, Nottingham City Council. So I spent some time there working with the city council on all the public health welfare, and I was kind of lucky that I got in straight away into the residency. So I started the training when I came to Singapore. Yeah.
So I mean, there are some of the listeners here who might not be familiar with what public health actually is, because a lot of us are practitioners. I mean, our course, especially in pharmacy, we are groomed to be practitioners.
Yeah.
So for those of us who might not be so sure, what does public health entail actually?
Okay, so public health is a very big term. It's like an umbrella term. So under public health, there are different tracks. So where we are right now in this pandemic era, it's we talk a lot about infectious disease, and it's actually it's a public health issues. It's a public health topic, and one of the biggest track, one of the pillars of public health is epidemiology. So you have epidemiology under public health, which they look after the health of the populations. It can be a communicable disease like this COVID-19, or it can be a non-communicable disease like the war on diabetes by the Singapore government. And there's other tracks as well. There is the health services research, which they focus more on the research part of the clinical practice. And also there is the policy part, which is my track, is in the health management policy track. So these are the three main tracks of public health. And of course, you have health promotion as well, like your health promotion board, HPB. So all this, essentially what public health is a practitioner that's looking after the health of the populations.
So what do you do in the health management policy track? Is that what it was?
Yes. So this is one of the tracks for the public health specialist training in Singapore. So for this track, you basically train to be someone who is shrewd and competent in health policy making, which also include regulations as well. That's why I spent some time in regulation with Jasmine. And at the same time, it's also about management of healthcare institutions. So for that part of training, I spent quite some time in polyclinics, apart from seeing patients, but also some of the back-end management work, and also in the restructured hospitals, and in some of other state board agencies like AIC. Yeah.
So Jess, you were mainly doing regulation also in MOH?
Yes. So we were both working on the Healthcare Services Act, and also looking into developing the regulations specifically for telemedicine. So we actually worked on setting up the sandbox together, and it was also kind of like how we got started with getting people into the sandbox. Yeah, and then one of the people we got into the sandbox was MyDoc.
So Matthew, how do you end up with MyDoc?
I mean, it's an interesting journey. So I spent quite some time in the government sector and also in MOH. So I'm actually quite interested to try it out at the other sides of the practice, the private practice, and see how things goes. To understand how digital health is being practiced on the ground by the providers and also by the patients. Yeah.
Do you miss practicing?
Yes, of course. I miss seeing patients in a clinic. I mean, I don't really enjoy doing walk around in the ward so much, but I kind of enjoy and miss interacting with the patients, with the uncle, aunties in the GP clinics, and the kind of doctor-patient relationship. Yeah.
Is that why you? I mean, at MyDoc, your clients or the patients are generally community based in that sense.
Yes. So for MyDoc, most of the patients are actually being treated or managed through the digital health platforms. There's not so much of the face-to-face interactions, but we do have an offline referral pathway. If the patients require some form of physical examination, physical review, they'll be referred to a brick-and-mortar clinics.
Okay. I hear from Jasmine that when you go into MyDoc, the patient actually has an opportunity to see a doctor or a pharmacist. Correct?
Yes.
Why would a patient choose to see a pharmacist if there is an option to see a doctor?
Now, I think what we are trying to do is we are trying to change the practice as well. So as we are aware, in quite a number of Western countries, there's a separation of prescribing and dispensing. So the doctors see the patients, and then the patients go to pharmacies for medications. And also in those countries, for example, where I was trained in UK, so patients, if they are sick, they do not necessarily go straight to the GP. They can go to see the pharmacist, and get advice and get medications. So again, I think what we are lacking in Singapore is that these separations, right? I think there's a lot more that pharmacists can offer. So that's why we have this platform. We are working with Guardian. We have this free Q&A service for patients to speak to a pharmacy, and if they require more inputs, or if they require medical inputs from doctors, then only then they get referred to see a doctor. If not, the pharmacist can actually handle the patients from end to end. Yeah.
Is there a difference in cost?
Yeah. So today I would say yes, because the pharmacy service is actually FOC today. Yeah, and it's 24/7.
Mm-hmm.
Yeah. But for the doctor service, you do have to pay a fees. Yeah.
Wait, did you say the pharmacy service is 24/7?
It is 24/7.
Oh wow!
Yeah.
So you have a pharmacist sitting in an office somewhere, managing a platform 24/7.
Not they. Okay. So Guardian is the one that is partnering us. So Guardian is the one that is handling all these manpower arrangements. But yes, of course, they do have someone on their end to handle all these queries that's coming.
It is, one of those things that we discuss, especially in our pharmacy hard talk show, is that we have to move with the trends and all these kinds of things for digital health, right? And now that I mean, it's the first time I'm hearing it. I didn't really know that Guardian actually has a pharmacist on standby 24/7. Yeah. Do you think that pharmacists are keen to take up these kinds of stuff? Because it's 24/7 and we've never really had to do this last time.
Yeah, I guess it's different. Actually, in terms of the hospital pharmacies, I guess it's not something that's new to them. A lot of them are on call 24/7 as well. It is something that's new to the community. And I think, in my opinion, doctors are also on call all the time. And part of their training, and even part of the 5 years and they're in the hospitals and stuff, they all had to do on call. So being there 24/7, it's not new to them, but it's definitely new to our profession. Yeah. Do you have anything to say?
Maybe I can just add. I would say with technology being so advanced, with everyone's having internet access, smartphone, all this, I think the consumer expectation has shifted quite a lot. If we talk about the last 15 to 20 years, so I mean, speed is one of the expectations. When they want something, you talk about same-day delivery, express delivery. So if you want to see a doctor, they want to see it, now, or even a pharmacist. Yeah.
Maybe one thing that I also wanted to explore is why is it that the pharmacy service is 24/7 but not the doctor service?
The doctor service is also 24/7.
Ah, okay.
Yes. Yes. It's fair. It's fair.
I just want to take a minute to say hi to everyone who is in the chat. Jocelyn is here. Hi, Kevin, KBL, who was here on episode 15. Hi, Damien. Hi, Serena, who's my mom. Hello. And hi, Eddie, who's here as well. Thank you all for joining us. So Matthew, just now we were talking about pharmacists being part of this MyDoc platform. Is there a significant take-up of this pharmacy service as compared to doctors?
So yes, definitely. So this pharmacy service has been around for a few years. Of course, today, because of COVID, people are more comfortable going online for all kinds of services. If you talk about the beginning, about 2015, 2016, it was quite slow. Yeah, but over the years, we've seen the take-up rate actually on the rise, especially with the COVID. We have seen an exponential increase in the number of people using the services. Yeah.
And the public is starting to warm up to this?
Yes. Yeah, because it's free, right? And then they can just ask, so it can be anything. It can be anything. So member of public can present to the pharmacist with all kinds of questions. What cream should I use for this rashes, all this? Then I can say, you should go for this cream. Yeah.
Excuse me.
Okay, then maybe I have the opportunity to ask the question. Like, do you have any issues like with patients, talking about the service, like do they have different feedback when they consult a pharmacist vis-a-vis a doctor on a digital platform?
You mean a different advice from the doctors and from the pharmacists?
Now, like from the patient's perspective, do you think they have different expectations when they speak to a pharmacist versus a doctor? And how has the feedback been generally positive, or have there been like actually instances when there were negative feedback when they were speaking to the pharmacist?
Not really. So the expectations, I would say, is the same. On the platform and so face to face, I would say. Yeah, this is actually the feedback that we gathered, from MyDoc, gathered from the Guardian pharmacists. Yeah, and generally, I would say the patient expect the same standards of care as well. Yeah.
Do they really get the same standards of care? Because one of those things that maybe professionals, maybe consumers are worried about also, it's a different kind of connection that you have across a camera or a screen versus like in a face-to-face, which is traditionally how you build relationships, right? With the expressions, with the way you come across, with that warm kind of feeling.
Yes.
Are you able to maintain that kind of standards when you come to digital health?
I would say the practice of now the thing about I think the difference is for pharmacists, there's not so much of a physical examination, whereas compared to doctors, there's always some form of expectations for physical examination. So if you compare medicine and pharmacy, I would say it is more manageable in terms of expectations on the end, because there's not so much of physical examination. So a lot of things is, doctors have this issue, what should I do? And a lot of things is through counseling, and which can be done on the platforms, be it using a video call or a text messaging function.
Are patients even worried that because it is digital, the doctor might not be able to make as accurate a diagnosis?
There is these possibilities, I would say. There is these possibilities, but so far we have not encountered any complaints in that respect. Yeah, because patient safety is the priority. If the pharmacist cannot handle it, then they are advised to actually refer the patient away to a brick and mortar clinics or to a walk-in pharmacy. Okay, just give me 1 second.
Yeah.
Okay.
Yes, one of those things that we were always discussing is
Okay.
last time when we talked about telepharmacy, right? And we were discussing why was it that it feels so different and the pharmacists feel like there is no connection. And one of the things that you mentioned was because we are doing it wrongly. Yeah. Do you feel that way?
I think the difference with video consult with the doctors is that you see the doctor's face, right? But when you go to the pharmacy, sometimes when it's a teleconsult or telepharmacy, as they say, is that you don't actually see the pharmacist's face.
But the pharmacist sees your face.
Yes, correct. And because of that, you don't really get to develop a kind of relationship over camera and virtually, which I think is one of the success factors of telemedicine for the doctor side of it. And it should be the same and should be applied for pharmacists as well.
By just being able to see the person who is serving you.
Yes, because I mean, a lot of times when you communicate with one person, whether or not the communication it flows well or you feel comfortable, is when you can see the other person's face. And you see how the person reacts to your inquiries. And for example, if you're talking to someone and then you see like they can't really be bothered to talk to you because they have something else to attend to, and it turns you off, and that's the connection is not built there. But then when you talk to someone, they're listening attentively, it makes you want to talk more. So it encourages the patient to share more. And which is why I feel like in the absence of being physically there, being able to see your expression, even your hand gestures, makes a lot of difference to the conversation.
The non-verbal communications. Yeah.
Correct.
So, I mean, let's just take a little step back, all right, and think about these telemedicine platforms in the landscape of public health. I mean, so Matthew, what do you see as what place do you think telemedicine health has in the public health scene in Singapore?
So, telemedicine, yes. So, when MOH, when we developed the national guidelines, telemedicine, it's umbrella term. So under telemedicine, there are different tracks, right? So there's a teleconsultations, telecollaborations. So the teleconsultation is between doctor and patients, collaboration is between two professionals. You have the telesupport, and the telesupport can be between the professionals and patients. And then you will have the telemonitoring, your gadgets that you wear, wearables. So there are different types of telemedicine. Different types. So it is still developing. I think if we talk about telemedicine, digital health, there's a lot of potential, I believe, in terms of public health, in terms of population's health. So apart from what we are doing today, teleconsults, especially in the era of COVID-19 pandemic, you make health, you make care more accessible to the patients, and also you can triage patients without them going to a physical clinics. By that, increase the risk of exposure to people around the patients, or also to the healthcare professionals. You can also there's also the value of collecting information, real-time healthcare information. So like the telemonitoring. So we are living in the digital age. Everything is about data, big data. It's the same for healthcare as well. So for persons, if you collect your data long enough, then it can really help doctors to actually better manage you, because the doctor can really understand what's going on when you are not at the clinics, right? So there is the white coat hypertension, because patients go to the office and then see doctor, but at home they are fine. So all these things can be managed using telemonitoring. So if we scale this up to a big populations, then you have population level data. So in a way, it helps the government to formulate healthcare policy. It helps ministries or HPP to actually come up with programs that is more targeted, depending on the population needs. Yeah.
So, but from all these kinds of monitoring, it means that, especially when you're looking at large population data, they require devices. Right? And without these devices, you essentially cannot collect the data in a very accurate way. And I mean, data that's not accurate is essentially pretty junk, lah. Correct. So, yeah. So, do you think the population has enough of such devices?
Well, I to be honest, in my opinion, I think we are not really there yet, but we are moving towards that directions. In order to have that kind of data, you need to have access to good devices. Today, I think this is not very common yet. For those who are very health conscious, they can go and get their own monitoring devices, gadgets, all this. But in terms of the whole population level, I think this is still quite limited. Yeah. So, but I think looking at the trend, I think we are moving towards that directions. Yeah. And of course, the quality of the devices is also another thing, right? So, there are good quality devices out there, but there are not many. Yeah, but with this COVID thing, I think, and also the interest in digital health or health technology, there are more and more people coming into this market and produce all these quality products. Yeah.
Oh, we have a comment from Leslie. I'm just going to read out the comment. Leslie says, I agree on the part about patients not being able to visually see the pharmacist during a telepharmacy consult. And he was quite shocked about it when he first came into practice. So now that I've been practicing for a little while, I realized that it may be the amount of money that the organization chooses to invest in the particular technology to have these telepharmacy consultations in what we perceive to be a more effective way. In that case, why is there no change? Right? And they're speculating that because maybe no one is pushing for it, and also upper management may be unable to see the ROI. And just some food for thought. So, I mean, Matthew, do you think that it's an issue of ROI? That's why companies seem to be not investing a lot into this kind of technologies?
Well, that's a very good comment. And right, one thing about economy is humans' response to incentive. So definitely, ROI is one of the top most important incentive for any businesses to actually go into the digital health space. There's an argument about digital health in Singapore. If you talk about Watson's, Guardians, they have so many branches all over the island. So it is actually very accessible. So what is the place of digital health, or telepharmacy in this case? So I think that is the thinking, which I believe, in the past few years, it hasn't become very, very mainstream. But with COVID-19, things have changed. Yeah.
So what should we then be doing to, okay, not so much to take advantage of the COVID-19 situation, but with COVID-19 being around, how should we be looking at digital health as a way to provide better services and better value?
Now, the way I look at digital health it's I would say maybe the first time in history where you can really connect a healthcare professionals with a patient. And by that I mean it's like a real connections or integrations of the care pathway. We talk about the different forms of telemedicine, telesupport, telemonitoring. So we shouldn't look at telepharmacy just as isolations. We should look at telepharmacy in the context of the whole digital health ecosystems. Together with telemonitoring, personalized healthcare devices, real-time health parameters monitoring. We should, and together with teleconsult with a doctor. So we should look at it in a whole, right? In a nutshell, together rather than isolation. So this is a time where, because of COVID-19, people are willing to try out new things. And when we look at digital health, digital health, I think where we want to go, the destination is something as I described. It is ecosystems that really supports the patient from different aspects of the healthcare. Yeah.
Maybe I have one question. I guess, like you mentioned, it's also different kind of practice in the UK and in Singapore. And there is a very close working relationship between different types of healthcare professionals in the UK healthcare landscape. But in Singapore, sad to say, I mean, I personally experience in the hospitals that this ecosystem is not necessarily always there. There are doctors who actually ensure that input is sought from like different healthcare professionals, but there are also those that work a bit more solo. So because of this lack of integration in our healthcare system, do you think that it is possible to create this integration in a digital healthcare landscape instead? Like physically they don't integrate very much. Do you think in the digital arena they can integrate better?
I would say yes, but they are different. There are different things that need to happen for this to happen, right? For a more integrated care to happen. Now, with digital health today, if you look at the market, it is actually still quite fragmented. You have just one company come out and do one thing in a digital care, and then another one in a digital care. So give you one example. It's the Ping Gu doctor in China. As we all know, China is a big country, and this company also has quite a big market share over there, and they are quite resourceful. They have managed to actually build quite a good ecosystems in China that actually include different types of care providers. So I think now that everyone has a smartphone, right? So with just a smartphone, you can have access to all these different providers at the same place, rather than compared to a traditional brick and mortar, to go to this and this and this, many different types of clinics in order to have different care. But today, with just one smartphone, right, you can have all these different types of providers in the same ecosystems. So I think it enables this ecosystem to be created. But for these systems to be created, of course, different people need to come together and then have the same goal, and the patients also need to demand that the ecosystem be built in such a way that we like to use this term, patient-centric, very patient-centric type of app or ecosystems. Yeah.
So right now there is no demand from the patients.
I would say there is demand, but then there is demand. There is also you have these appointment booking apps out there, right, that allows you to book appointment with doctors or sometimes with physiotherapists, all this. But again, it is still fragmented, right? So a lot of these providers, they are just doing one thing. Multiple providers doing multiple things, but they are, somehow it needs to be joined together, integrated. Not just booking an appointment with a doctor, but also book appointment with a physiotherapist, but not just booking a face-to-face appointment, but also a digital consultation, but also at the same time you have integrated medical records that is shared among all these different providers, and then you have other functions like telemonitoring, all integrated, and data being shared among all these different providers. So again, the term that we like to use, patient-centric. Yeah.
Yeah. So I mean, from what I'm hearing is actually you think that the digital healthcare, the digital landscape actually makes it easier to aggregate different professions together, right? So it should encourage a greater collaboration. But do you think that this is something that is a role that should be done ground up? Like, should the ground be the one creating these networks, or do you think the government should play a bigger role in creating such networks?
I think that, it is not a straightforward answer, I must say, but I think government definitely has quite an important role to play in this scenario, because unless you are talking about big countries like China, big countries like US, where you have a very matured healthcare systems, right? Because there are so, for example, US, you have so many different states, and then one state that can have a very mature private healthcare systems where they have all kind of services involved, so they can have their own ecosystems. But if you, by that I mean, all different types of providers are actually part under one healthcare systems. Then, if you are talking about private sector in Singapore, private sector today, because Singapore is not a very big country, so I don't think we have that kind of scale. But if you are talking about government, if you're talking about NHG, SingHealth, or NUHS, these are the government ecosystems that can make this happen. Yeah.
And it will make sense for this to happen, right? Because if you are talking about having consolidated medical records, it's going to be very difficult to achieve that without working with the government in some form or other, because that's where the bulk of the records actually are.
Yes, correct. So again, it varies from countries to countries depending on the healthcare systems, definitely. In the case of Singapore, you are right, 80% of the primary care take place in polyclinics. So definitely, if you exclude polyclinics, then, it will not be complete. Yeah.
What do you think that there's a high take-up rate? I mean, is there a certain percentage of take-up rate for these kinds of digital health apps in Singapore? Would you consider it high?
In Singapore, it's I can't comment, for the whole country. But if you look at the data published by Telehealth, Telehealth is one of the pioneer provider in telemedicine. It's the company in US. The annual actualization rates of people actually using teleconsultations or digital consultation is about 13%. Yeah, but this is pre-COVID era. Yeah.
Do you think it's because maybe if let's say the take-up rate is not extremely high, do you think it's because Singapore is so small and it's too easy to see a doctor anywhere rather than having to go onto your phone and go through an app?
I do agree. I do agree. This definitely plays a part, in terms of how accessible it is for you to see a brick and mortar clinics doctor. So it does play a part. But again, digital health, it's not just teleconsultation, right? There's also telepharmacy, there's also telemonitoring, telesupport, others. So electronic health records. So we should look at it, as a whole instead of just individual. Yeah.
So maybe I just want to say, do you think, Sean and I were also discussing it earlier, do you think with all these digital health and now that you're accessible to a doctor, you don't have to travel, do you think that it will result in jobs for healthcare professionals in the future? And with AI, do you think this will put healthcare professionals out of jobs?
Okay, so there's this question is being asked by a lot of people. I think not just in the healthcare industries, of course, all industries. When they talk about the fourth industrial revolutions, the digital age, information age, or the AI automations, there's a lot of worries and questions about machines replacing human. Of course, I think it's possible in healthcare. It is definitely possible. I would say it definitely has an impact. Not in the near future, but in maybe 10, 20 years, I think there is a possibility. But definitely, it will not replace all doctors. Okay, it will replace some doctors. So certain specialties, definitely the number of doctors that you require today And compared to in the future, you might not require as many doctors because some of the work can be replaced by machines. I think definitely that there's an impact. Yeah.
Then with the current system of training for the medical doctors, when they come out, do you find that they are actually ready to embark on something so new like that? Does the training give them preparation for this new future, which seems to be accelerated because of COVID?
That's a very good question. I can't give you, I can't give you. I mean, I can't comment on what's going on in medical school right now because I'm not involved in designing the curriculum. But in my point of view, I think, as you rightly mentioned, because things are moving so fast, I think a lot of medical schools, a lot of educations and institutions are playing catch up with future-proof the educations. Regarding medical educations, I think you at this point, no one actually can foresee what's going to happen in 10 or 20 years for sure because things are moving so fast. So the things that they learn today might not be relevant 10 or 20 years later. That's all I can say. So I think what's more important is teaching the student to have this mindset to be very agile, very flexible, and also most importantly, the continuous learning. I mean, we have the CME points, all this. I mean, same for pharmacists as well. I think is this thing about continuous professional training should keep up with the demands of the market. AI, all this. This should be part of the training, moving forward to keep everyone, updated with the new advancement. Yeah.
So you think one of the biggest values that new healthcare professionals, not just pharmacists or doctors, but in general, new healthcare professionals, when they come out into the market, they should have these values of being agile.
Yes. I would say in the future, technology and healthcare will go hand in hand. So it is very important for all professionals to adopt a very open-minded kind of mindset, especially when it comes to technology. We use technology every day, and definitely it has a lot of value in terms of improving safety and also productivity. Yeah.
Speaking of being open-minded, when MyDoc came into Singapore, maybe not just MyDoc, but digital health in general, as you are trying to share this idea and this way of doing things, do you get any pushback from the clinicians that you are trying to work with? Because you do need clinicians to support your product before you can roll it out to the community, right? And usually when change is not easy, but what do you get pushback from the clinicians that you are working with?
Yeah, definitely. Change is not easy, and change won't happen overnight, especially for healthcare. Change does normally take quite a long time to happen. If the doctors don't buy in, then it won't happen, right? So especially for healthcare, highly regulated industries, when we want to roll out telemedicine or digital health, we need to get buy-in from the doctors, the providers, and also at the same time buy-in from patients as well. So on the provider side, we work very closely with them. During my time at MOH, we actually engage the professional associations, the hospitals, the clinics to get their opinion, to get their comment, and then we put in measures to ensure that this thing will happen eventually. But it is how we want to make sure how do we want to ensure that it happens in a very safe manner.
What are some of their worries, and should they really be worried about that?
Of course, some of the worries I think are very valid because there's inherent limitations to telemedicine. For example, you cannot do physical examinations today. So these are all these inherent limitations of telemedicine today. So they are right to be worried about that. So we work together with the providers all type of providers to ensure we put in regulations and standards to mitigate all these concerns. Yeah.
And that's on the clinician side.
Yes.
Is the community worried about adopting this?
I think community-wise, the worry actually has come from different aspect. So care quality is one. So some of them share the same concern as the providers. How do you ensure that this is the right diagnosis without physical examinations? And the other type of concerns is data security. So data security it's another issue, especially when we have quite a serious cybersecurity breach involved with structural hospitals. So this is also top concerns as well. So all these things are valid. So when we were at MOH, me and Jasmine, we work together to make sure all these concerns are being addressed.
So maybe I can just ask, but from a more personal point of view, when you speak to your friends and other clinicians and they're saying that I don't understand why you are doing telemedicine, it's not something that you support and that kind of thing, do you feel demoralized? And if you did, what would be some advice you would give, if you're pushing for something that others may view to be controversial?
So it is. So far, I have not received such comment. I think this COVID-19 situations have changed people's perspective, definitely. Right. So it really helped, as you mentioned, accelerate the whole digital transformations. And again, digital health or teleconsultation is just one of the branches of digital health or telemedicine. So there are still, telemonitoring, telesupport. So we should not be just looking at teleconsultation. We should be, expand our eyesight to the whole spectrum of digital medicine. So there is a lot of potential. So I'll tell them, don't just look at teleconsultation alone, but look at the whole sphere of digital space. There's a VR, right? There's a virtual reality that you can use for doctors training, surgeons training, and then there's the augmented reality that can be used for tele-rehabilitations as well. And then there is all this remote surgery that can be done in the future, especially with 5G coming on board. And you have the other sphere, which is the data, the big data, predictive analysis, all this, both ends, the preventive end and also at the treatment ends. So the possibility is endless, and we are just at the beginning. With now a lot of attention given to digital health, I think a lot more things will happen in the future.
Do you think 5G is going to be a game changer in digital health?
I would say yes. So one of the things about 5G, so there are many things, right? So first you need big data, right? So with 5G, a lot of things are being enabled. 5G is a great enabler. So all these healthcare devices, gadgets, there's a lot of potential to collect real-time data. All kinds of data can be collected, and also at the same time, the physical barrier is really being removed because the speed is so fast. You can have the doctors doing surgery from US on the patients in Singapore, and then you can have all this. I don't know, maybe your phone can actually measure your heartbeat, like the stethoscopes, all this. So there's a lot of possibilities that we never know, right? Yeah.
And when we think of, go ahead, Jasmine.
Yeah, sorry. Just one thing that Sean and I were also discussing, because of all the data that we're collecting, do you think there will be a huge concern with the privacy aspect of it? It will mean yes, maybe you don't collect the names back end, but it will mean very much about one person, right? Their lifestyle, because it's always being tracked, right, by the monitoring devices. And What do you think about this? Like, do you think it's an invasion of patients' privacy, or do you think it's a necessary invasion because it's healthcare?
When it comes to data, it's very sensitive. It varies from countries to countries or from culture to culture. So different countries, the people have different type of mindset, and the level of acceptance in terms of how much data you're willing to contribute is also very different. So in the name of healthcare, in the name of technology advancement, some people are willing to compromise all this. But I would say this is for each country to decide for themselves, how much level of tolerance or acceptance they are willing to let go of their privacy in terms of data. Of course, cybersecurity, data security, it is important, right? That one cannot be compromised. But it's also important that when you collect so much data, right, the data has to be put into good use, right? So, it has to be put in good use, good data be collected and then put in good use. Normally, when you talk about big data analysis or AI, you have to make sure that all this algorithm that you use is actually the right one, replicable, can be validated, and also there's no inherent kind of bias or mistake inside. Yeah.
Do you think Singaporeans or people in Singapore have this high level of acceptance or willingness to share their data?
I would say yes. I'm quite confident.
You think so? Really?
Yeah.
I mean, when I think about the government trying to use satellite ERP, I get scared already. Thought I on my engine and they're tracking where I am. You think that they are ready? I mean, they have a high level of willingness to share their data?
So I think in this aspect is really the confidence of the people on their government. So I think in general, Singaporeans as a whole, they have quite high level of confidence and trust in the government. Of course, it can never be 100%, but I mean, compared to quite a number of Western countries, I think they have relatively a significant higher level of trust in the government. Yeah.
So they trust the government. Do they trust you as a private company to manage the data?
So that is a very good question. So, but in the whole, it is, I would say, in terms of data security, cyber security, I would say the government has to be at the driver's seat to make sure, even the data collected by private companies, there is a general framework laid out by the government to ensure that it is being protected in the safest manner possible. Yeah.
What would you say to the community to reassure them that their data is safe and they should move forward? Because one of the things that's preventing people from being more readily adapting or adopting these technologies is a worry about, what are you going to do with my medical information? What would you say to that?
Correct. So it is the responsibilities of the government and also the company. It is the responsibility of them to reassure the consumers or the patients about collecting their information. And one of the way to help this happen, I would say, is they need to help them to understand the reason behind why they collect certain data. So, for example, I mentioned about this company called Ping An Doctor in China. They have quite a big scale. China is a large country, 1.4 billion people. So when we talk about big data, theirs is really like big data, right? So because of the scale of the data they collect, they're able to do all kinds of very futuristic kind of analysis, predictive analysis, predictive modeling. We talk about COVID-19. If we talk about utilizing big data, they're able to predict, the outbreak, the next outbreak, all this just from this sheer data collections, with algorithms at the back end, they can actually identify, okay, there is this small outbreak of this disease at this area. So based on our analysis, maybe this is something new, this is something that's worth looking deeper. Yeah.
So it comes down to communicating the reason why you are collecting the data and why it's important, and the potential to be able to help people eventually with the data that's collected as a whole.
Yes, it's very similar to the situation we have today, right? So why people are willing to forego some of their personal freedom, not going out, staying at home, wear masks, although it's not so comfortable, is because people they're looking at the big picture. They're looking at the welfare of the population as a whole, rather just looking at them, as an individual. So it is really the government to reassure the people, at the same time to help them to look at the positive, the benefits of sharing those information.
One of the comments that we have from Leslie, which thank you very much for engaging with us. He says, I feel that a part of the reason for the low uptake may be because our seniors aren't as tech savvy as the younger generation. And I think it's safe to say that most seniors aren't ready for change. From his organization, he sees a huge group of patients who tend to use telemed services are the expats, right, and those that actually come to collect their prescription medicines. Do you think that it is difficult to convince seniors? Because I mean, technically seniors are the vulnerable population and they are the ones who need it the most. But if they don't take up technology, and this is the way that the country is moving, they're going to be left behind.
It's true. It's true. This is the information that we gather from our internal data as well. I would say we cannot blame the elderly populations for not picking up, being a laggard or something like that. I think we have to also think about whether, we design our services or apps at the convenience of the elderly, or so it's like healthcare providers. We always talk about patient-centric. It's the same thing for the apps as well. Do you design your apps? Do you design your services with elderly patients in mind, right? Because today we look at all the apps in the App Store, a lot of them are not designed with the elderly populations in mind. Yeah.
And what else do you think we need to do to increase adoption by elderly?
Okay. Again, I would say it has to be elderly-friendly workflow, elderly-friendly ecosystem, elderly-friendly apps. When the product manager design the apps, the front-end, back-end engineer, or everyone together with the provider, right, the doctors, and maybe get our elderly patients to come in to think about how do you design an app that's very elderly-friendly, right? Not overly complicated, not too many buttons to press.
Yeah.
So that's very important.
Yeah, I think that's quite interesting as well, because if we see that the mobile phone penetration in Singapore is so high, then the device itself actually is not the issue. It's probably the software and the apps that become the issue on why people are not adopting it. Of course, when you speak about the entire ecosystem, then you're also talking about other players that come into play, right? Because you have other physical devices, and you mentioned something like what, remote stethoscopes or something like that.
Yeah. Correct. So it's everything. Not just the software, but the hardware as well. The kind of wearables, all this. It has to serve the purpose. Who is the target customer? Who is the user? Aging populations is not just in Singapore, but it's happening around the world as well. So in terms of public health, you want to improve the welfare or the general health of this population. So how do you go about doing it? And then this is just one of the area that we need to look at now. Yeah. The government like to say aging in place, right? So how do you ensure aging in place? So we need to look at all this. I think the government actually are looking at it. The multi-ministry task force with the URA to look at the infrastructures, all this. Even HDB, they are also talking about smart home, having this capability of you calling a doctor or someone to healthcare professional can visit you with like a smart panel in your home, all this. So the government, they're already looking at that.
So you're with MyDoc, right now, where does MyDoc want to be, as a company in the future of Singapore's healthcare system?
I think we want to be an enabler. Of course, we have a very beautiful interface to connect the professionals with the patients. There's a lot. I mean, just having the connections in between these two stakeholders, and also at the same time with the payers, in this case, the insurance provider, there's a lot of possibilities can happen here. We want to build these ecosystems where, every time when patients they have issues and health problems, the first thing I think about is to go to our app and then seek help. Yeah.
Oh, okay. We are at almost 1 hour, 10 minutes into our chat. Raymond, Leslie says the hardest part of designing the user interface is simplifying it, right? And it's difficult to create a simple design. Yeah. And Raymond says making the UI accessible or friendly to the high touch elderly population. What's a high touch elderly population? Do you know?
I have no idea.
No idea. Raymond, maybe you can tell us what you mean by a high touch elderly population. Okay. While we go on to the next topic.
Actually, I have one thing to add. Like, I think one of the things, especially in healthcare, that we don't consider is product design and development. And that's something that actually a lot of companies do it, branding and stuff. And like, how do you reach out to your target population, right? This is something that other companies, tech companies, non-tech companies, anybody that develops any type of product does. And I think it's just something that's quite new to the healthcare sector. And, like Matthew mentioned, we are still growing and still developing in this space. And it's really about getting accustomed to what is already being done in the market and adapting it for healthcare specifically.
Oh,
yeah. Raymond came back.
Okay, let's check out what Raymond said. And he says high touch refers to the involvement of personal attention and service. In business, the term often refers to situations where trust between the customer and employed individual is necessary. And high touch areas include medicine, wealth management, real estate, and legal. Wikipedia, the source. Who teach you to use Wikipedia as your source? Huh?
Oh, come on. We all use it, when you need a quick answer. Or you just type into Google.
Not me. But yeah, I think at the end of the day, we try to mimic as far as possible the same kind of touch, the same kind of experience that you have face to face. And it comes from, of course, the perspective of not just trying to mimic that, but what else can you do with the technology? Yeah, there's always two perspectives, right? This technology sucks, or how can I make the best use of this technology to enhance the value that I can provide to the customer, or in these terms, is the patient. Okay, so let's take a step back from all the work stuff, and I just want to ask Matthew. You have a young kid who's crying in the background early on. How do you manage work-life balance in that sense? Because you have a young family to take care of, you have a huge role to play at MyDoc. Is it difficult to cope?
Oh wow! It's certainly not easy. I think partly because of COVID as well. I'm actually a PR, so me and my wife, we're a PR. Family is back in Malaysia, so under normal circumstances, they'll be here helping us to look after the baby. Baby is 9 months old, but because of COVID, it cannot come, so it's just two of us. It is not easy. A lot of adjustments, not just adjustment to having a baby, but also, as all of us are, adjustment to this new normal. I would say, well, now it becomes like a relationship workshop. I would say, it requires a lot of understanding, for spouses to understand each other, understand your expectations, understand your limitations, understand each other's needs and how we can help each other out.
Yeah, I guess one of the reasons why I asked this question, I also spoke with Sean about this question because I find it very impressive that you started a new job and then you have a kid, and then you also mentioned your parents cannot come, and then how do you deal with this? Like, I think a lot of, even in the healthcare community or pharmacists, they are not keen to start something new, especially if they are going to start a family. They feel like it cannot go side by side, and you have done it side by side. I mean, a bit difficult, but I think it has been. You're still actively doing it, and like just wondering, like, what kind of advice will you give to like young pharmacists and young families?
Okay. Again, I would say I think both persons should understand yourself, lah. You should understand your strength, your weakness. If your strength, your weakness, and call for help also if you need. And you must really understand yourself, okay? Your feeling, what you're thinking, and also at the same time, it's also as important to understand what your partners are thinking, what they're going through as well. So that we have a baseline, right? We have a baseline. So whether you like it or not, whether there's a need for sacrifice or compromise, there's always a baseline. And then both persons respect each other's baseline and then try as much as possible to help each other out as well. So when I say understand yourself means, when you feel stressed, when you feel like you need to take a break, you go and take a break. Okay. When you need to push, you push. When you need help, you must tell your partner that you need help, then your partner will help. Then your partner also must be respectful and understandable to say, okay, I will help you. Of course, you cannot expect your partner to help you all the time, all the way, right? You also need to be self-conscious to step in as well. So it's require a lot of cooperation, communication, talking to each other. It is not easy. Conflict bound to happen, but you have to accept it. You take it as it is, bound to happen. But even before it happens, you already know that, because you already know that this is going to happen, so that when it happens, you are not so shocked, and you sort of already have a prepared mindset to handle it. Yeah.
Okay. So I think in a minute we're going to get Matthew's final thoughts, and we'll wrap up the conversation and carry on celebrating National Day. But I think from our discussion today, it seems to me that in telemedicine or digital health itself, it's a whole ecosystem of things. It's never just one part. It's not just teleconsultation. Everything has to come together. The support from the government, management of healthcare records, devices that are not just technologically able to provide the information that we need, but there's also the really large part, which is convincing people to adopt it. And not just because it's cool, but I mean, for the people who need it the most, arguably it's the toughest to change their minds on what would help them in the future. And we eventually will have to adopt all these technologies because that's the way we are moving forward, right? And because of COVID, what was seen as the future, it seems to be right now already. It's accelerated so fast, and everyone is pushed at a speed where we're just not comfortable with it. But yet, people generally are working well. And from the professional perspective, agility seems to be a key part of a professional's growth. Because as Matthew said, who's to know what's going to happen in 5 or 10 years? I mean, who would know that COVID is coming right now? No one, like absolutely no one. And those with the most agile mindsets and those who are able to adapt, even if you cannot predict, if you can adapt, you tend to, as they say, not just survive but thrive in the situation, no matter what the circumstances are. Jasmine, your thoughts?
I think what Matthew mentioned earlier also about being very open-minded and looking at things from the big picture is actually one of the key, I mean, how do you say it? It's like the way you look at the future of healthcare. I mean, yes, you can look at healthcare and how this individual component actually grows, but you have to see how it fits into the ecosystem. And looking at how it fits in the ecosystem, like you also mentioned, requires quite a lot of adaptability. You need to see what does this ecosystem entail and how do you then fit into it, and how does your profession actually offers a value to it. Like if you don't see and you don't grow and you don't thrive with it, I mean, it's very likely for a lot of professions and a lot of services or even specialties to actually die because you failed to adapt. So I think one of the key things is really adaptability is really, really very important. And maybe you're not quick to adapt. Maybe change is not something that you're very comfortable with, but I think it's something that we cannot avoid. And it's something that needs to be continually discussed so that you can help it grow or guide the growth in a very safe manner and something that you want it to be and what you think it should be for the future. Yeah.
And at a pace that's comfortable for everyone.
Yes.
Because it's if the professionals move too fast and the community is not ready, hey, guess what? Nothing's really going to move. Right. Matthew, your final thoughts.
Well, first of all, I must say, for whoever that's joining us now, I think, I'm glad, I'm happy, and thank you for spending your precious holiday, national holiday here with us. Listen to me talking. I would say, again, keeping an open mind and enjoy whatever there is to come. COVID-19 it's not so easy to keeping positive. But I think we have to. For whatever development that is coming, I think we just have to be open-minded, and then we just have to be adaptable, and we just have to go and try it out. I would say not everything will be beneficial, but we should be open-minded to just go and explore and see whether there's any value, and whether to us as a provider or to the patients, what's the value of this. So just being curious.
All right. Okay. So we've come to the end of today's conversation. Thank you so much, Matthew, for joining us and sharing our insights. And as always, Jasmine, thank you. And thank you, of course, for bringing Matthew in to share his thoughts with us. Yeah. Okay. So everyone, have a good National Day. Thank you. And we'll see you again next Sunday at 3:00. Okay. Bye-bye, everyone. Take care.
Okay. Thank
Bye-bye.
you. Thanks.
Yeah.
Bye.
Hey, and if you haven't subscribed, go and subscribe. We're only 20 subscribers away from 100 subscribers. Okay. Bye, everyone. Take care.
Goodbye.
Bye.